Well, most states are seeing an increase in COVID-19 cases, and Cedar Rapids is one of the many communities in Iowa grappling with rising case numbers. However, as Becky Phelps reports, hospital leaders there say their facilities are better equipped than when the pandemic began.
I can't even stress that in the magnitude of the things that we know that we didn't know.
Unity Point Hospital is feeling much more prepared for a surge in cases than it did back in March when the coronavirus first started taking off. As local positive COVID-19 cases are continuing to rise, Chief Medical Officer Dr. Dustin Arnold says he isn't worried about the hospital being overwhelmed.
We're status green on pharmacy, blood, personal protective equipment. Every capacity, every place we need to be, we're doing well.
He says the hospital first started getting back on its feet in May, and now they have a better understanding of how the virus works, and although there's no cure, they have ways to treat it.
We knew what to expect, we knew how to handle it. We were giving convalescent plasma. We've had remdesivir at that time.
Early on, PPE was in short supply, but now they have plenty. Mercy Medical Center Dr. Tony Myers says both hospitals have even decreased ICU space, which they had tripled.
While we decreased capacity, we still have double of what we would normally have. That would easily take care of a similar surge that we saw in April.
Despite their confidence in handling cases, doctors say they'd prefer people don't catch the virus. The majority of the recent rise in cases has been 18 to 25-year-olds, but Dr. Myers says he expects to see a bigger impact within a few weeks.
Now are younger people, but eventually the people that are most risk, the older people and people with medical conditions, will get exposed if the community continues to surge.
And COVID-19 cases are setting new single-day records nationwide and in several states. Compared to last week, 33 states report an increase in new infections.